Myxomatous mitral valve disease is the most frequent cause of mitral regurgitation in our canine companions. As this condition progresses, it can become irreversible and eventually may not respond to standard medical treatments, leading to a poor outlook for the affected dogs.
Exactly. While pharmacotherapy plays a vital role, there comes a point where it might not be enough. This is where surgical intervention becomes a possibility for selected cases with severe mitral regurgitation. In human medicine, mitral valve repair is often preferred over replacement because it can better restore heart function, help prevent blood clots, and offer better long-term results. This approach is increasingly being used in veterinary medicine as well.
However, it's important to note that unlike in human medicine, there isn't yet a universal standard or set of guidelines for how to perform mitral valve repair in dogs. There are still questions about techniques, such as how to adjust the size of the valve annulus, how to determine the proper length for artificial chordae tendineae, and how best to monitor the valve both during and after surgery. To improve and standardize these techniques in canine patients, we need more information quantifying the effects of surgery on the mitral valve complex and the blood flow dynamics.
Precisely. Prior studies have looked at the mitral valve annulus geometry in sick dogs before surgery using echocardiography and correlated it with measurements taken during surgery. But there hasn't been much published data evaluating these effects after surgery in dogs.
And that brings us to the goals of this specific study. The researchers aim to evaluate several key aspects of surgical mitral valve repair in dogs with myxomatous mitral valve disease. The surgical technique used in all cases involved an artificial chordal replacement and mitral annuloplasty. The annuloplasty involved shortening the parietal annulus until its area matched the size of the septal leaflet. Artificial chordae were then adjusted to ensure the leaflets met properly at the plane of the newly created mitral annulus. During the observation period, 3 dogs sadly passed away due to complications related to the surgery. However, the overall 3-month postoperative survival rate for the study was quite high at 96.1%.
A very important finding was related to pulmonary edema. Every dog had a history of acute pulmonary edema before surgery, which was under control at the time of the procedure. None of the dogs developed a recurrence of acute pulmonary edema after the mitral valve repair. Looking at medication use, the percentage of dogs receiving pimobendan was significantly lower at 3 months postoperatively compared to before surgery and even 1 week after surgery. Similarly, the ratios of dogs receiving diuretics and other heart medications also decreased significantly after surgery.